There are various muscles and their tendon around the elbow joint. Because we use our hands and our arms for so many things, these tendons can become irritated due to repetitive use and overloading, for example with computer use, sport, or work. One common example of this is tennis elbow, or lateral elbow pain. Pain can be mild to severe. It can be felt in the extensor muscles on the outside part of the elbow and back of the forearm. This type of issue can also occur with tendons of the flexor muscles on the inside of the elbow and even the back of the elbow with the triceps tendon. Usually these symptoms are caused by increased repetitive activity or new activities of the arm, wrist or hand. Such activities could include a new computer setup, activities involving gripping or a change in equipment such as a new tennis racket. These repetitive loading can cause these tendons to become inflamed and painful. There are also ligaments around the elbow, as with any joint, help with stabilisation. The ligaments running along either side of the elbow joint can become aggravated or sprained with overloading, commonly occurring with activities such as large amounts of throwing, causing these ligaments to become constantly overstretched. At the back of the elbow, there is a small sac of fluid called a bursa, which are found all over the body and help prevent structures from rubbing against one another. If there is repetitive impact to this area through falling on a hard surface or even leaning on your elbows on a desk repetitively, this bursa can become irritated, inflamed, and painful. Osteoarthritis is another common condition where the cushioning between bones of a joint wear down and the joints become aggravated. This can occur in the elbow joint. It can feel painful and swollen and reduce how much you can move your elbow. You may also feel a grating sensation or a locking of the joint. Acute elbow injuries are those which occur suddenly, usually due to high impact loading or an impact on the joint. Examples of this may include a fall, being tackled during sport, or a high force movement such as throwing. Ligaments that run either side of the elbow joint can be sprained or ruptured with sudden high force movements or impact to the area. This can happen in instances where there is no prior issues with the elbow joint, such as impact being tackled during sport, or it can occur after a long period of aggravation to the ligament, such as a baseball pitcher who has repeated stress on the ligament. Tendons, which join our muscles to bone, can also be suddenly sprained or ruptured. Examples can include the biceps muscle tendon at the front of the arm, which can occur with heavy lifting, or the triceps tendon at the back of the arm, which can occur with landing on outstretched arms during a fall. Any strain or partial tear will be very painful at the location of the injury with associated swelling and bruising. The acronym RISA is important in the first 24 hours. Rest the joint, limiting movement. Apply ice for 15 minutes every 2 hours to reduce swelling. Apply gentle compression, such as a compression bandage. Elevate the area above the heart level to reduce the amount of pain and swelling, and refer by going to see your GP or physiotherapist for guidance and management. Mild pain, which resolves after 2 to 3 days with a complete return to normal function, would be considered no cause for concern. However, pain of higher intensity, significant swelling and bruising, and pain which lasts longer than a few days should be investigated by your doctor. Fractures can also occur at the elbow joint and must be seen to promptly to ensure they recovered without complications. Fractures commonly occur from impact, such as with falls on the arm or hands. They feel very painful around the area with associated swelling and can be difficult to move. Visiting your GP early will ensure the required investigations and management take place. You will always be referred on to a specialist doctor by your GP or physiotherapist if required. For example, other assessments may be required, such as MRIs or X-rays. These are only used if a fracture is suspected, if the extent of your injury is unclear, or if further information is required in order to manage your rehabilitation. Another reason may be for a surgical opinion if it is deemed necessary. Once the initial early phase of management occurs, physiotherapists and other health professionals will be a key component of your recovery. This stage of rehabilitation after your injury will ensure you regain the movement of your elbow, regain the strength and conditioning of your joints, tissues and bones, and enable you to return to the activities that you love.